Welcome back, and now for our story. The Healthcare Sierra Leone, USA, has met with local medical practitioners to discuss on chronic disease and addiction disorders in the country. The aim was to raise awareness on the increase in chronic diseases and substance abuse among young people in particular, and how to address them. Joseph Toure witnessed the event at the FCC auditorium.
This gathering of both Sierra Leone medical doctors living in the USA and in the UK was to chat on strategies in addressing chronic disease and addiction disorders in the country. During her presentation, keynote speaker Dr. Nelly Bell indicated that chronic disease and addiction significantly impact the health and well-being of citizens, presenting substantial challenges to the nation's healthcare system. She also told the gathering that studies have shown that the increase in substance abuse is prevalent among youth between the ages of 20 and 29. Chronic disease, she went on, is a visual cycle and there is a treatment gap in responding to it.
We should concentrate on the first 1,000 days of life, so the pregnant woman and the child up to 2 years of age, to be able to break that vicious cycle. And also we need to have a holistic approach to prevention of addiction and chronic diseases.
Chairman Healthcare Sierra Leone USA, Dr. Michael Pierce, said the institution will continue to support the prevention of chronic disease in the country. He said they were committed to give back to their motherland through education and providing healthcare services.
So we want you to know that our goal is to continue with education, so that we can be able to prevent all these chronic illnesses that are occurring in this country. Because though we are all specialists in our areas, various areas, we do believe that preventive care is the key to good health, not only in Sierra Leone, but in the world at large.
During a panel discussion, medical experts said there was a need to focus on malnutrition among children to prevent chronic diseases. They also noted peer pressure has been a cause for substance abuse among young people. An appeal was also made by the practitioners to treat mental health issues with all seriousness. Most importantly, they said, children should be educated on such issues and structures be put in place to treat addiction and mental health issues. Responding to the concerns on chronic diseases and addiction disorders among other health issues, Deputy Minister of Health 1, Dr. Charles Senesi, said government was committed to address the situation.
As a government, we are very much concerned, and we have dealt with this when it all started by making sure that the pharmacy will actually analyze the active substances that are used, especially push. So let's also water the content of it as well, and we'll put that analysis done. Even before we as a government took it as a really public health emergency, which we declared. And we have proposed for a lot of infrastructure, which I will delve into later into the symposium. But as a government, we have taken strong leadership for this particular impact of our country.
At the end of the session, one thing that came out strong was that chronic diseases and addiction disorders are not only medical issues, but they have both social and economic impact on Sierra Leone. SLBC, Joseph Toure reporting.